Thanks to the committee for allowing us to be here, and I appreciate your time and consideration. I'm from Manchester, Kentucky, and I practice in primary care, although not a traditional family practice these days. I do almost 100% of my practice is built around osteopathic manipulative treatment. I'm a DO, not an MD. Went to the Pikeville College School of Osteopathic Medicine in their third class. As I say, I'm from Eastern Kentucky, so as a primary care provider, I do have a dog in this fight. And as you hear stories like this, there are countless stories like this. And one of the more frustrating things in medicine is to have potential tools that are not available, that we are not allowed to use or recommend with patients when there is a significant amount of evidence that benefits exist. And when we talk about those benefits, if you want to compare it to anything else in our pharmacopoeia, there are a few things that are as safe or as tolerable. And regardless of perhaps preconceived misgivings about delivery forms, concentrations, and things of that nature, I think if the legislature would give physicians the potential to work with patients, that we could guide patients in a safe manner, an effective manner, and with very few negative outcomes. Again, these kind of stories are not few and far between. They're commonplace. And doing primarily osteopathic manipulation, a good portion of my practice is built around pain management. Fewer than 1% of my patients are actually taking narcotics on a chronic basis. And again, I think if we had more tools like this that we could use in combination with other potentially non-addictive and non-life-threatening treatments, it would help countless patients. And again, when I look at managing a patient, the primary issues are risks versus benefits. And when we talk about medical marijuana, there's just nothing else that compares. There are no fatal overdoses associated with that medication. You can't say the same thing about over-the-counter medications like Tylenol or aspirin. Again, I would encourage you to move forward with this legislature. Again, there countless numbers of patients are being left out in the cold. They don't have the tools that are available in other places, and so the evidence continues to build, showing benefits that exist, and again, very few negative outcomes associated with that. So if you have any questions, I would love to make myself available to answer those questions, at least from a primary care doctor's point of view. Please let me know if there's anything I could do that would clear up any misgivings that you might have about moving forward with this.